Here with Dr. Morales again. Continuing my series, marathon of my new questions in the operating room. Those guys who follow me, this is what I do for a living. I love what I do, and I spend at least 20 to 30 hours a week here in one of my operating suites at ACPS, and that's my second home, so I love it here. But I want to take a few minutes to kind of answer some of the questions. I'm way backlogged. So the question today is about the butt, and the question is, how will my butt feel after butt augmentation with implants? Great question, because butt implants are completely different than breast implants, like not even close to the same. They're so different, the way they're engineered. Breast implants are basically a silicone shell with either saline or gel inside of it, very squishy. They're designed to feel like breast tissue, so they're supposed to be very, very soft. Butt implants, on the other hand, or gluteal implants, are actually a formed solid silicone piece. It's one piece of silicone. It's poured in a mold and poured into whatever shape or size it has desired. And so it comes out as a whole piece of silicone. It's carvable. I can cut it. I can shape it. They come in different. Now I can even get a block and I can start cutting on my own. I can freestyle my whatever I want to do. It's form stable, completely cohesive silicone, like a gel. So they come in different shapes and different sizes, different projections, how tall they are, how wide they are. It just depends on the patient's anatomy. The concept of how it's going to feel depends 100% on the patient's body and how much body fat they have naturally. So patients who typically want this surgery are either going to be one of two. First one is that they're really skinny and they don't have enough fat to do a typical fat transfer for buttock augmentation. And so they're very skinny. And so an implant's only able to give that desired look that they want, for the fullness that they want. Because if you do the fat transfer, it's like not even doing anything. That's patient one who wants the surgery. Patient two is someone who has either done fat transfer before and not happy with the volume and the size or the shape of the projection of it. So it's kind of a failed BBL, okay? So that's the second patient. I've had usually history, they've had it done before, not happy with it, they want more fullness, and it just didn't give them the desires they want. And so that's typically another patient that comes to me for that. The third patient is, hopefully becoming more common, is that they just know that they've done the research, they've watched my YouTube video, they've seen what I've done, they've seen my before and after, they know they're just gonna need an implant, so that's what they end up doing. So patients who have a little more kind of fatty tissue on their butt, when you put an implant in, it's gonna be less palpable, or you can't feel it quite as much. These implants that I use are the softest implants we have on the market in the United States right now. They're the softest. I didn't do butt augmentation until these implants came out. The other ones, the other brand that makes them, they're just way too hard. They're hard as rocks, and I don't like them. These new ones are more squishy. I think they are the softest ones we have, and I think they give good outcomes. So, and if you're really thin, you have like this much skin and fat over that implant, you're just gonna feel the implant more. And it's not a hard thing, it's still soft, but it's firm. It feels firmer than like breasts. And I think women get a little disillusioned about it. My butt should be very soft and jiggly. It's not gonna be like your breast tissue, just not. It's not gonna be like a natural butt, because really, if you just go down to it, your muscle's kind of firm. Well, this is what an implant feels. It feels like a very firm, like muscle kind of thing. That's what it feels like typically. If you have a little more fat tissue covering the implant, then again, you don't feel it as much. You have a little more kind of squish to it, so you'll be able to kind of touch it and kind of a little bit softer. Patients who are a little bit fuller back in their backside, they ask me, will I be able to twerk? And the answer is yes. Like, there's a lot of famous social media models that have implants, more than you think, and they're twerking away. And so yes, it's twerkable. If you want to call that a word. But yeah, it works, and but I always tell my patients that's what you should expect. There is some firmness to it, especially the leaner you are. You will feel the implants more firm. It's hard to hide an implant when you're really, 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 really lean. Like, I do the best I can. The way my techniques are, the idea is to hide as best as possible, but it really comes down to soft tissue coverage on any aspect of the body, actually, not just the butt, but also the breast too. Same thing in the breast. When you're really lean, like my competitors get really lean, and you can see a little edge of the implant. It's because you have skin and maybe a little couple cells of fat, and then you have the implant. So it's the same concept. But to feel the implant on a butt, it's going to be a little bit firmer. That's what it's going to feel like. So hope to answer your question. I got that one a lot in the past couple weeks. So hope I answered for you. Thanks for following, and we'll see you soon.